Senator Husakos.
Government leader, a new FOI-based report from secondstreet.org has revealed a national tragedy. 23,746 Canadians died last year while waiting for surgeries or diagnostic procedures. Since 2018, more than 100,000 people who have died not because they received bad care, but because they never received care at all. For years, the opposition warned that this government's choices, its spending, its priorities, and particularly its failure to manage immigration and population growth, pushing houses, healthcare, and services to a breaking point. So tell us, government leader, how can this government possibly defend its record when tens of thousands of Canadians are literally dying in line? And while it, finally admit, and won't the government finally admit that its own mismanagement and lack of fiscal anchor has driven our healthcare system into a crisis situation?
Senator Moro.
Yeah, well, the government of Canada and the new government is willing to work with provinces concerning how to help with the healthcare system. The government will invest massively and will collaborate with provinces to make sure that healthcare everywhere in Canada can improve. And I told you that before, but the way you are describing things, you said your argument is I look with pink glasses. Your description of Canada is not the Canada that I see, is not the Canada that Canadian witness, and certainly not the Canada that the will that Canadian expressed during the last election. I think that this government is bringing hope to Canadian, and is committed to continue to work to bring hope to Canadian and to invest in the Canadian economy, create jobs, and help Canadian.
Senator Husakos.
I see Canada as the greatest country in the world, but the greatest country in the world speaks for the 100,000 Canadians who've lost their lives waiting for care and health care, something that we Canadians think is unacceptable. And it's not enough to say, well, we won the last election, because those voices weren't able to be heard in the last election because they didn't get sufficient care to be able to go vote. So these are the people that I'm fighting for. These are the voices that I'm standing for. So when will the government understand we're not here to represent only the well-to-do, but those that are suffering as well?
Senator Moro.
I answered to your question earlier today, Senator Husakos, that what the government is doing is investing to help Canadians everywhere. Housing, for instance, people homelessness, people who are in danger of being homeless. The government is investing billions of dollars to that. Don't tell to Canadians that the government doesn't care about what the Canadians are living. I think that this government proved by investing in Canada that he really cares for Canadians.
Senator Martin.
Yep. Government leader, at yesterday's meeting of the House of Commons Standing Committee on Health, my colleague MP Dan Mazur highlighted that Immigration, Refugees and Citizenship Canada has been promoting Canada's supposedly free healthcare system as part of its communication strategy to attract newcomers. Yet, as Senator Husakos just noted, more than 23,000 Canadians died last year while waiting for surgeries or diagnostic procedures, and additionally, over 6.5 million Canadians are still without a family doctor.
Shame.
So, Leader, Canadians are facing unprecedented strain and deteriorating access to care. Isn't it deeply insulting for your government to market a healthcare system abroad that is clearly failing to deliver adequately to Canadians at home?
Yep.
Senator Moro.
About family doctors' access to transform Canada's healthcare system, it means all levels of government and health partners working together to do what's needed so Canadians can get the healthcare they deserve. It's not only a federal jurisdiction, it's every government jurisdiction. Healthcare workers need support by getting more health workers into the system faster. The government is stepping up with close to $200 billion in direct healthcare funding to transform the healthcare system together with provinces and territory. This is more than words. It's money. It's $200 billion. The deal with PT's target what matters most to Canadians, more doctors and nurses, shorter wait times, better health care. The government is committed to that.
Senator Martin.
Well, Leader, my question was relating to what the IRCC is saying to people abroad. So officials also testified that the Minister of Immigration wasn't even aware of her own department's communication strategy. This follows her inability last week to answer basic questions on the interim federal health program. After 10 years of Liberal mismanagement, Canadians deserve competence. Will the Prime Minister replace this minister and take our immigration system seriously?
Senator,
Do you think that as government representative in the Senate, I'm the one who will tell you whether or not the Prime Minister, how the Prime Minister will manage his cabinet? I think that the fact that the Prime Minister is supporting the member of his cabinet, if it's the answer that you want to have on my part, as far as I'm concerned, I answer that there's more than only words, there's action, because the government of Canada...
Senator Moreau. Merci.
Thank you, Senator Moreau.